Good morning. Welcome aboard. If you're just joining us, you are right on time. Today, we're having a very important conversation. As Ramadan approaches, it's pretty much around the corner. We want to get into the best practices when it comes to fasting, especially for those living with diabetes and beyond, of course. And joining me in studio is Dr. Rilwan Adan. She's a physician and a diabetologist. In fact, Dr. Rilwan is a distinguished, member who is currently the head of the Lions Diabetes Care Center in Nairobi and the VP of Kenya Diabetes Study Group as well. And in terms of educational background, it is so robust and so diverse. She holds an MBCHB in Medicine and Surgery from the University of Nairobi. She's a member of the Royal College of Physicians in the UK. She has an MSc in Public Health from Warwick University and a higher diploma in Diabetology from Cardiff. I mean, Doctor, this is grand when it comes to your, educational background, your experience, and we're so glad to have you. Welcome.
Thank you so much, Malika. I'm glad to be here today.
Amazing. So, we are really going to get into the conversation very deeply in a few short minutes. So you need to stay with us, because truly, what happens to your body when you're fasting, and what do you need to do to take care of it in the best way possible? All that and more coming up. Stay right here. It is Barsat Kidun playing for you right here on Radio 44. Good morning, I'm Malika, and thank you for joining us. We are jumping right into this very important conversation with Dr. Rilwan here in studio, all about fasting, the precautions, the best practices, of course, when you're living with diabetes and fasting and beyond. So Dr. Rilwan, to lay the land pretty much in general, when we fast throughout the day, what is happening with the body generally as the hours go by?
So basically, for what we say normal physiology, that is normal functioning of even a healthy individual. So when we eat, whatever we eat, especially the foods, the proteins, the carbs that we eat get converted to glucose. So glucose is the main energy source that is used by our muscles, but is used by our brain and all that. So when you're fasting, especially during Ramadan, being a dry fast, you don't have this glucose coming in. So what happens to our body? So the organ, the liver, stores what we call glycogen. It's like the liver is like a store. So when you don't have this sugar or blood or glucose coming in, the liver starts breaking down what we call a process called glycogenolysis. So your insulin level goes down, because insulin ideally is produced by the body when it senses that there is sugar coming in. So the production increases so that it can mop out this sugar from the blood and takes it to your organs to give you energy to be able to function. So now that this is not happening, the insulin levels are going down, the liver is activated to start producing energy for the body by a process called glycogenolysis. So glycogenolysis usually occurs around 6-12 hours. By the 12th hour, it also starts slowing down. So the body now switches to fat metabolism. Your excess fats now start breaking down. So this is a process called gluconeogenesis, now where the fat is converted to sugar to be able to provide energy for your body, your brain to be able to function, your muscles to be able to move, and all that. So this process actually now, as you continue having the dry fast, it's your body is constantly having energy and the normal glucose level, because now other processes are taking over. So that's essentially what takes place in your body physiologically, even for a normal healthy individual.
Okay. Now, given that is what's happening, what are some of the best practices then to adopt, before you fast, and also even maybe something afterwards as well when you have iftar, when you break your fast? What do you suggest are those kind of things that should be kept in mind, so that, while your body is, of course, undergoing that process while you are fasting, it's kind of supported in the best way possible?
Yep. So basically, for a normal individual, essentially, this is usually taken care of, and so your body is functioning at probably the amount of calories that, depending on individual, that comes in is different. And so if you're used to high energy levels eating pattern, your body usually senses that your sugars are going lower than expected, because probably the the replenishing mechanism which physiologically occurs is not at par with what usually comes in. So the brain senses that this is not the amount of sugar you usually get, and you get symptoms of probably low blood sugar like headaches, and some people feel fatigue and tired, and so those are the common symptoms that you feel as a result of that. For people living with diabetes, it's quite different in the way that they're already taking medications that is lowering their sugar level, and they're not taking the energy levels that they're used to in their body. So what the risk of having low blood sugars is high, especially for those who don't see their healthcare professionals and have their medications adjusted based on what their intake is. So they have that risk of low blood sugar. And then because during the breaking of the fast, you have that sense of, I've been away from food the whole day. So we tend to have what we call postprandial hyperglycemia. That just means that after you break your fast and you eat, your sugars really shoot up.
Right.
So you have high risk of very high blood sugars after breaking the fast, and you see people having a lot of fatigue, even then tiredness, because of that load of sugar that is coming in. So those are the risks that we have, and more importantly, especially now, I think today the weather is a bit different, but with the heat, you'll also experience a lot of dehydration. And even in our people living with diabetes, you'll have that as a major risk. And remember the physiological mechanism that I told you, where the body starts breaking down fat. For our patients who are totally dependent on insulin and do not produce insulin, there is a risk of what we call ketoacidosis, because this fat production to provide energy produces what we call ketones, and when ketones are high, you form an acidotic milieu or environment in the body, and that can be a bit risky for people who do not have insulin production. So these are the risks that you have, and how to mitigate this risk really is for us to have a conversation. Diabetes management is highly individualized. Every patient is different. Every metabolic process for each individual is different, and so we manage them according to their individual state. And so medication adjustments is required. Eating patterns, or changing your eating patterns, is essentially quite critical to be able to manage the highs and the lows that are expected at particular times. And so we hold our patients' hands through this period for those who want to fast, and we carry them through this process at an individualized level.
Okay, so just in general, for somebody living with diabetes, what would be a good way to open the fast that is not going to, give the body too much of a shock when it comes to the sugars?
Okay, so we essentially break our fast as a sunnah using dates. So we advise at least 2 to 3 small dates. The size of the dates really matter with the sugar load as well. So if you're taking a big date as compared to a small one, the sugar load is different. So we advise small dates. Water, obviously, to break the fast. Advice against sugary drinks, fruit juices, because fruits have fructose, which spikes your sugars. And so water is what we advise. And with the dates, with the sugar load, there are studies which have shown that the rate of sugar absorption is reduced depending on what you take it with. For example, if you take it with healthy fats, like with the seeds or with nuts, you tend to have, like you have the almond dates, it tends to reduce the absorption of sugar that goes in with the sugar that's coming in with the dates. So that we advise, and then we advise a healthy meal, obviously, after that. So sequential eating is also advised, not just loading the stomach all at once. So you take your water and probably go for prayers, and then come back and you have your plate, and your plate is essentially balanced in terms of your vegetables, your protein, and your carbs. I know some people again tend to have a bit of a dessert afterwards, so we tend to advise them to avoid stacking of their carbohydrates, meaning that if you're planning to have something a bit later, probably reduce the carbs on the plates that you're having for your meal, so that you can be able to probably take something else that will spike your sugars later. So sequentially phasing the food and the amount of micronutrients in your plates, and macro in terms of the carbs, proteins, and veggies is quite important.
Okay.
Yeah.
Okay, great. There's also a lot of conversation when it comes to insulin in general and diets and inflammation. So we're going to really dive into that shortly. Stay with us. It's Asta Gill with Q playing for you on Radio 44, and we've been having a very important conversation in studio. I have Dr. Rilwan Adan with me, a diabetologist, and she really is, focusing a lot on how we can ensure that as Ramadan approaches, fasting is made in the most easiest way possible, a process that somebody living with diabetes is able to, of course, engage in, and also generally people in general. So doctor, as we zoom out, looking at diabetes in general now, type 2, as we were talking about off air, is most common, where insulin resistance is a key factor. Obesity is a great issue leading to this, and we're seeing a lot more young people also having diabetes and type 2 diabetes in Kenya as the days go by. So there's this abuse of the GLP-1 drug that many have noted across the world when it comes to medication that is supposed to be managing diabetes being just used as this quick weight loss hack, right? What are the risks with that?
Just to take you back a second, so the family of drugs are GLP-1, what we call GLP-1 analogs. I think commonly people know it as Ozempic in the market. There are others also, but basically it was initially for type 2 diabetes, tested and researched for type 2 diabetes, but it was noted that it also causes weight loss, which is an added benefit, especially for our people living with obesity. So obesity right now is characterized as a chronic condition, just like we do with diabetes, just like we do with hypertension. So we need to manage it. And with obesity, it leads to many other chronic conditions. So managing it is important for us. So when you talk and ask about risks associated with this, GLP-1 analogs, I want to emphasize, are prescription medications, because there are factors we look at before we prescribe it for you. And so just getting it from anywhere and using it because you are overweight or you are obese is actually not right, because we have other causes of obesity, which we have other conditions that cause obesity, other therapies that cause obesity. So obesity itself, not all obesity is essentially managed with GLP-1 analogs. So we need to investigate you. We have, I know conditions like hypothyroidism can cause weight gain, and some people can become obese. And so we need to investigate what really is driving your obesity before you get this. So before you get to treat it, first of all, is it the right treatment for it, is what we're talking about. So it's just not a medication that is made for everybody who is obese. Yes, it has been licensed at a certain dosage levels for management of obesity.
Okay, but it really is about your healthcare provider saying you need it and it's okay. It's not just something, that you should try and get in on as a fad, because it can have really negative adverse effects then if your body has other factors relating to it, right?
Absolutely. I just last night I had a forward from one of my patients telling me these drugs are causing blindness and blah, and there is, I think, a lawsuit to the manufacturer. It was a sort of a news piece from some international media, and yes, there's been associated risks with that, and that is why we look at you as a patient individually and say, are you susceptible or predisposed to having this complication of blindness? So there are things we look at to be able to ascertain that. So that is why we say it's not for everybody. So we need to assess you and tell you. I have had patients who really need the drug, but we look at their eyes and we say, no, we can't give it to you right now because of the nature of your eyes. So I know you knowing that Lions essentially is an eye hospital, and so we check their eyes before we tend to prescribe for them, especially those patients who have diabetes and uncontrolled diabetes. So we need to really evaluate the patients before we prescribe it. So it's not just meant for everybody. And then obviously there are other adverse effects, especially pertaining to the gut, in terms of side effects of pertaining to your stomach and all that. And we guide them and help them through the process of how to avoid some of these side effects, and how to potentially, for those who need the drug, how to be able to alleviate those symptoms. So it's something that you need a healthcare provider who is actually trained in terms of using the therapy to take you through the journey. It's not just something you get off the counter or off somewhere and you just use it for yourself. So regulation is really quite key in terms of how we use the drug. Yeah.
Absolutely. And of course, to remind you once again, of course, Dr. Adan is serving as the head of the Lions Diabetes Care Center in Nairobi as well. So talking of another fad that we've seen, there's intermittent fasting. And I think some people see quite a bit of success with it just in general. And this is, of course, beyond how we talk about fasting for Ramadan. This is, as we discussed, it's that 16-hour gap between eating, 8 hours you're able to eat and things, mostly how some people tend to look at it. What are some of the benefits, do you think, of doing something like intermittent fasting?
So intermittent fasting has really been studied in medicine in terms of therapy. Interesting, because last month I attended a conference, and this talk on intermittent fasting was being given by a psychiatrist. So apparently it even has some health benefits in terms of the mental health. It was really quite interesting to note that. But intermittent fasting, essentially in our space of metabolic health, has been studied vast. When we initially started this, we talked about the normal body physiology, where you have the liver being a storage organ, and it stores and it breaks down. And so essentially, if you're not doing intermittent fasting, or rather if you're eating quite often throughout the day, you're eating your breakfast, you're snacking after 2-3 hours, you're having lunch after another 2 hours, and then you're having another snack after another 2 hours, then you're having dinner after another 3 hours. Basically, you're not giving you're constantly producing insulin. So because you're putting it in your body, whenever you put in sugar or glucose, or and when I say glucose, it's not essentially just sugar that you put in your tea, probably some carbs that you're taking, bread or potatoes or rice or any wheat and all that you're taking, your body is spiking insulin to be able to get rid of this from the blood to provide energy. And like me, if you're sitting in the clinic the whole day and there's no energy expenditure, you're not using this energy, the liver is storing it in terms of fat. So, and you're not giving the liver time to break it down because you're constantly eating.
So more and more.
Yes.
Yeah.
Remember glycogenolysis, which is breakdown from the liver to provide energy, occurs when your insulin level goes down, when you're not feeding. So you're not giving the liver that space really to be able to break down and provide you with energy. So intermittent fasting sort of provides for that. And now, in fact, in the metabolic space, we have a condition called MASLD, metabolic associated steatotic liver disease, which is coming up quickly as a major cause of liver failure, because the fat is expanding in your liver and destroying your liver tissue.
Gosh.
And so the fat is overtaking your liver, so it's destroying your liver. So it's also associated with diabetes, it's associated with obesity. So the fat storage that you're doing, you continue gaining weight, you continue disrupting your metabolic pattern, and so type 2 diabetes, liver dysfunction, and all that follows subsequently. So with the intermittent fasting, really you're giving that space of your insulin levels to go down because you're not eating, and you're giving your liver a chance to break down to have the glycogenolysis process happening, because now it's providing your body with energy. So, and then obviously there is the sugar control that comes with it, and weight loss. But now the eating window also matters really. So when you come and you compensate that 16 hours that you've not been eating, and now you have the 8 hours,
huge meals.
And so really eating healthy is the key message here. So within even that 8 hours, if you could avoid your sugars, if you could eat a healthy meal, energy input vis-a-vis expenditure, try to balance that. So what you're taking in, burn it as well, and so that you can be able to maintain metabolic good metabolic profile.
So within that, let's say just in general, like for Ramadan when you're fasting as well, and even if you're intermittent fasting for that period of time, which is like 10 plus hours at the minimum, do you think cortisol spiking then also is a risk factor that's playing in here?
So when your insulin goes down and you're not taking, when you're not taking in glucose, your insulin goes down, your sugar tends to go down as well because you're not taking in food. So when that happens, automatically your brain is signaled.
It's worried.
It's yes, it gets the message that, oh, by the way, your sugar is going down, so this is probably a time to take in something. But you can't because you're doing either your intermittent fasting or you're doing your Ramadan. So what happens is your body produces what we call counter-regulatory hormones. These counter-regulatory hormones are what we call catecholamines, epinephrine, cortisol being one of them. So cortisol is a driver of sugar into your blood. So it drives sugar into your blood to be able to give you that sustenance and tell the brain, oh, there's some sugar in the blood, so relax, you're not going into hypos and you're not feeling. So there is some minimal increase in cortisol because it's the body's mechanism of trying to maintain the balance of the sugar. I wouldn't say hypercortisolism in the sense that it's very high. Probably cortisol is also a stress hormone, so when you're stressed, your cortisol also goes up. So probably now you're stressed, you're fasting, probably your cortisol will minimally sort of go up to be able to maintain the body balance really in terms of the sugar levels and all that. But I wouldn't put it at an alarming rate to be able to give now a diagnosis of you're having hypercortisolism as such. No.
Okay.
Yeah.
Okay. Interesting. So we are going to dive a little bit further into some more fasting practices and beyond in the next few minutes. Stay with us. It's 48 minutes past 8 with Gehra Hua from Durandar. We are actually coming to the tail end of our conversation today in studio. Joining me, of course, has been Dr. Rilwan Adan. And Doctor, as we come towards the close of this, another trend that I would love to ask you about, because I've asked you about all the trends today, is the whole protein focus that we've seen. It's like everybody is telling you, from your grandma to your auntie to your mom, have more protein. Everybody's saying that's good for you. What is your take on protein, especially with Ramadan coming up, with fasting, for those living with diabetes and beyond, the role of protein in your diet in general, and also having enough of it during this period?
So proteins are an essential macronutrient in terms of our food. I think the big protein, I think all over, like you're saying, everyone is telling you protein.
The trend.
Yes, it's probably a lot driven by, again, the weight loss and all that. Because for weight loss, we recommend at least up to 1.2 gram of protein intake. Remember, what drives weight and all that is not that we focus on in medicine is essentially fat, or what we call adiposity. And so when we lose the fat and we're using therapies for weight loss and all that, you also essentially tend to reduce your muscle mass. You need your muscles in terms of strength, in terms of mobility, because it's what's holding your skeletal tissue together for you to be able to move and all that. And as we age as well, we tend to lose muscle mass. So you need to build this muscle mass, and protein is an important building block for the muscles. And you can't build muscle and you're just taking in protein if you're not doing strength training or resistance exercises. So when you take in the protein, you need to do the resistance training as well. And so even for weight loss, we advise our patients, don't just look at the scale as well, because again, if you're losing the fat and you're building muscle, you're taking in your protein and you're doing your strength training, your muscle will still contribute to your weight as well. So in the context of fasting is, I explained to you the physiology of fasting. So initially the breakdown that happens is with your fat, your glycogen, and then your fat and all that. Prolonged fasting is what leads to muscle breakdown, and so that is when now you're advised again take proteins and all that. But key is during Ramadan we advise our patients to take proteins, especially at suhoor, because what protein does for you is it does not spike your sugar. So proteins can provide you with energy through the gluconeogenesis pathway. The proteins can also be converted to glucose in terms of providing you energy. So it gives you slow rise in sugar levels. So especially for morning or suhoor food
time,
when you're taking your meal at suhoor, we advise you to take a high protein, because now you'll have sustained energy levels throughout the day, as opposed to taking a simple carb where your sugars will shoot and by 9-10 a.m. you're having a dip and you're crashing and you're having hypos. So they give you sustained energy release throughout the day, and so it's advisable to take it more in terms of sustaining your energy balance. As we age as well, as your protein intake should actually increase from 1.5 grams per kilogram to 1.8 grams per kilogram in your meal, because now we have what we call muscle loss happening with aging, and so that's why you find a reduced movement as people age, because they're losing muscle. They don't move as fast as they used to when you're in your 40s or 50s, and when you're getting to your 60s, 70s, it goes down. So the building of your muscles in terms of taking your protein and taking resistance training is quite important. Remember, again, a lot of proteins, excessive proteins, so you need to liaise with your dietitian as well. How much per grams per kg do you require, essentially? So we have a lot of body composition analysis that we do in terms of trying to ascertain what is your deficit that you already have that you need to build, and then now on top of that maintaining what is required, because again, excess is not good. We caution our patients, our patients living with diabetes, some of them have chronic kidney disease, and we caution them on the amount of proteins that you take, because it can potentially lead to further renal kidney damage when you take a lot of it. So it's, again, like I said, metabolic health is really individualized. Every patient's metabolism is different. So just because everyone is taking this, I wouldn't advise like now it's everybody to take this, like you call it. Now it becomes a trend for everybody to do that. So it's good to know, assess your body, you know your body composition, what it requires, and you move from there.
Amazing. And even as we wrap up, what would be your last few, bits of advice for those who are fasting while living with diabetes, and in general, those who are, of course, going to embark on the Ramadan journey very soon?
So people living with diabetes and Ramadan, the risks are potentially low, your blood sugars falling, especially after iftar, your blood sugars rising, and dehydration is another risk that we look at. So I would advise for every person living with diabetes to please see their healthcare professional to be able to get the individualized advice that they need. A lot of people may need their medications being adjusted. They can't just go into it like that. And I know a lot of people tend to avoid their medications because now they don't want to go having low sugars. That is not advisable, because when you're non-compliant, again, it will have its own separate complications that come in. So I would advise them to see their healthcare professionals. Importantly, with living with diabetes and fasting, you need to monitor your sugars. You need to know what you need to be in the know of what's happening with you. So that is another key issue that you should discuss with your healthcare professionals. When should you monitor? And when you monitor, what levels do you expect at what particular time? What target should they set for you, so that you know if you go beyond this, you're not supposed to break your fast. You know when you go below this, probably you need to break your fast. And importantly is to know when to break the fast. So I would advise that every person living with diabetes to have a conversation with their healthcare provider.
All right. Thank you so much, Dr. Rilwan. It's been a pleasure having you, and we look forward to hosting you even again.
Thank you. Thank you.
All righty. With that, I am going to wrap up this hour shortly, but I do have something courtesy of Ed Sheeran right here.